I found this note while I was cleaning my apartment today. The meaning of spirituality is beauty, new beginnings, protection, and self-expression.
The work in the mental health and spirituality space has been long neglected, and much to the detriment of service users of mental health services all around Australia. This notion of spiritual health, we don't talk about it much, we don't hear much about it, and our work has been to raise that profile. So Spiritual Health Association is the peak body for spiritual care services in health in Australia. We have been around for 50 odd years, providing services and expertise and guidance in this space. A large part of Spiritual Health Association's remit is to create awareness and advocate for the biopsychosocial spiritual model of care, and it aligns beautifully to the World Health Organisation's 4 domains of well-being. And those 4 domains of well-being are the physical, the mental, the social and the spiritual. And when one of those components is overlooked, we're not attending to holistic person-centred care. So our remit is solely focused on bringing attention to the spiritual domain of a person's holistic expression.
I used to run a support group at St Vincent's for 17 years, done a lot of advocacy work in the federal, state and even local levels, been a mental health advocate in this area for 40 odd years. When my illness was first diagnosed, I was studying at Melbourne University. I wasn't going to allow this big setback to defeat me. My faith and my religion helped me to be able to know that I could get back on my feet and be hopeful. Graduating through that meant a big thing for me, because that was having an education it meant a huge thing for me, yeah.
I've always believed I've been a spiritual person. My father was very religious, going to church every Sunday. As I got older, I thought, well, maybe I'm a little bit like him. 12 years ago, I went on my own path and read about Buddhism, and I really enjoyed the Buddhist principles that they had in the books. Spirituality to me means being confident, being well, being grateful, also believing yourself, which can mean self-love and trusting yourself.
Most of the stories that come out of religion or spiritual care in the area of mental health have been negative stories. The thing is that there are more positive stories out there that need to be voiced out to the wider community. And this is one of the prime reasons why I became part of the Spiritual Health Care Lived Experience Advisory Group.
We see spirituality as an umbrella term, and if we think about an umbrella having lots of different spokes, those spokes holding the umbrella up signify the different ways in which people may choose to express their spirituality. So religious practice comes as one of those spokes under the umbrella. Some of the other spokes that hold the umbrella up may be how we connect with nature. A lot of Australians connect to their spirituality through activities in nature. For others, it might be volunteer or community work activities. For others again, it might be how they express themselves through dance, music, creating art or writing. So you can see there's a range of ways that people express their spirituality. And therefore it becomes really important as healthcare professionals that we develop a spiritual literacy around this area so that we can then respond appropriately to people's spiritual health needs.
As the saying says, you can lead a horse to water, but you can't make him drink. Professionals can give advice as much as they like, but they can't make the individual take that advice. Spirituality has a different domain. It comes from within an individual. Something like that should be encouraged and should not be diminished. Any spiritual engagement offers a purpose to the individual in life. Connecting to like-minded people with church activities, all these good things, the virtues that come into the picture through a religion or spiritual are strong values in providing a purpose to a person.
If you don't deal with yourself or your own, whether it's emotions or feelings, it's very hard to live in this world. I was diagnosed bipolar depression when I was a teenager. I've gone through severe depression to the point of suicidal ideation. Today I'm a much better person, more equipped. I don't get stressed as much as I used to. Spirituality, as I said, has always been with me. To me, spirituality is having a purposeful life. You've got to call it your own and do what is purposeful for you. What's provided me to have a purposeful life is the paid work and non-paid work that I've done throughout the decades. In my mid-20s, I volunteered at what was then called Museum of Victoria, now it's called Melbourne Museum, for 6 years. And then I decided after 6 years, I'll go back to uni. So I did an art curatorship museum management course, still connecting with art the whole time I was doing the museum course.
We work to the recovery model of care in mental health service delivery. When we look a bit deeper at that, we get to see that the recovery model is very similar to spiritual care values. They both talk about hope, meaning, purpose, connection, feeling empowered, but most of our mental health services don't have a way of integrating spirituality and spiritual care into their service delivery.
The waiting times for mental health care has become problematic because the demand for it has become more and more. The medical intervention cannot be ignored completely for religious care. Both go side by side in providing care for an individual. What mental health care of today should be is that they should focus on the strengths of the individual, and they should probe what the strengths of the individuals are and encourage those strengths. Now, a lot of individuals might say that religion may be a strength. There are a lot of other options that can coincide with the medical option. And so the practitioner should not put their own judgment into the counselling role. But what they should do is encourage those potential strengths to grow.
I feel I've created my own version of Buddhism. I don't practice it, and I understand the ceremonies that go on and things like that. But I enjoy telling people, live in the moment. So long as I have that belief and I can't impart it to anyone else, that's fine. It's not about forcing things onto people. It's about respecting what you believe and being there for others as well.
So to start your spiritual health journey, I would encourage people to go back to those 3 words, meaning, purpose and connection. To take some time to contemplate where in your life do you find meaning, purpose and connection. And the answers to those questions will kind of guide you towards the things that make your heart and soul sing. For some people, that may be connecting with a community. For others, it might turn out to be a much more solo, individual pursuit.
person needs to be hopeful, needs to be around people, needs to get advice from others, not be in a cocoon, not be isolated. Application, effort, and listening to people and trying to connect with the wider community, that's recovery for an individual. And the church, the religion side, that helped me to be able to connect with people.
Love is an important part of spirituality. Expressing self-love is about the way you treat yourself, the way you think. And for me, the best way to think is be happy every day. Just be happy and not stress about, what is happiness, and just be. Being is a big deal, is a big part of spirituality, I believe. Being present, being in the moment, enjoying what you do, and above all, rest.
The recovery of an individual isn't an individual recovery, it is a collective recovery. It's people working all together to get that individual back on their feet. The more options a person has, the more potential the person will reach recovery quicker.
This has piqued your interest in spiritual health and you're wondering, what can I do about my own situation? I would encourage you to come back to those 3 words which found the definition of spirituality: meaning, purpose and connection. And when we ask ourselves, where in my life do I derive meaning, purpose and connection, we generally end up at our spiritual health. When we attend to our inner lives, our outer lives begin to flourish and blossom.